Welcome to our next episode of Cities Speak. I'm Clarence Anthony, your host and CEO and Executive Director of the National League of Cities. One of the things that we're hearing more and more from all of you and our subscribers and city leaders is that you're increasingly having to deal with a new challenge every day. And that's rising hate, extremism, and polarization in your communities. Whether it's responding to hate crimes or having to mitigate disruptive disagreements between residents over hot-button issues, it's just difficult now to be a public leader. And it's often something that city leaders didn't necessarily think they would have to deal with when they ran for public office. You know, they may have run because of crime, water rates, zoning issues, housing in their community, but clearly they didn't run because they knew that the climate that exists now would exist. But given what we're seeing in the headlines every day, this trend is unfortunately on the rise, and local leaders are left to put the pieces back together. At the National League of Cities, we want to help you all through that. And we are working to put together resources for you to use to more effectively respond to, recover from, and ideally prevent these issues altogether. We're doing that partially through a new partnership with Strong Cities Network. Strong Cities Network is a global network of over 220 cities, urban and rural, big and small, focused on developing the best tools and practices for addressing hate, extremism, and polarization. Here in the U.S., one question that comes up often in this process is how cities can partner with the federal government, not just to respond to these instances, but to prevent them from ever happening in the first place. Today, our guest is here to provide some answers to that question. Several federal agencies are working on this topic, and the Department of Homeland Security is one of the leaders amongst them. So today, our guest, and we're very happy to have him here today, is Bill Braniff, who is the director of the Center for Prevention Programs and Partnerships at the Department of Homeland Security. Bill, thank you so much for joining us, and welcome to Cities Speak.
Thank you, Clarence. It's my honor to be here.
I can tell you have a really, really long title. How do you usually, when people introduce you or you introduce yourself, how do you usually introduce yourself?
So interestingly enough, I actually like to use the entire name of the office, the Center for Prevention Programs and Partnerships, because we can't do this work alone at the Department of Homeland Security. In fact, we can only do it through partnerships with individuals like your listeners. We work with cities, we work with county executives, we work with state governments, we work with interested citizens and non-governmental organizations to create prevention programs that help prevent this violence from occurring in the first place. So I actually think the name is albeit a mouthful, is illustrative.
Are you seeing an uptick in engagement with cities and towns and counties?
We absolutely are, yes. And it's because of what you alluded to in your introduction. If people feel like every time they look at a news article or watch a news clip, they're hearing about another act of targeted violence, that's not wrong. When we look at data, since the early 1990s compared with the last several years, there's been about a 2,000% increase in mass casualty plots in the United States. And that's based on research from the University of Maryland, the START program. 2,000% increase in mass casualty plots. We're seeing that these plots range from a whole host of different motivations. Some are mobilized because of a terrorist ideology. Some are mobilized because of a bias, like a hate crime bias. Some are motivated by individual level grievances, perhaps a workplace shooting or a school shooting where the individual isn't motivated by an ideology, but a fixation on violence as a way to address a personal grievance. And so we're seeing just this increase in these forms of violence across the board. And for that reason, we're trying to identify a methodology, a paradigm, a way to prevent all of those forms of violence from manifesting, whether or not they manifest as hate or terror or a school shooting. And so I'm really excited to be able to talk to your community about the strategy that we've adopted. And really, I hope that our city and county level partners will adopt, because here's the paradox, here's the punchline. While violence has increased, in really significant ways across the United States, paradoxically, most of this violence is preventable. In school shootings, we know over 80% of school shooters leak their intention before they engage in that act of violence. For mass casualty attackers, 47% of mass casualty attackers leak their intention. They tell someone they're going to do it in general terms before they take action. People are often engaging in this violence because there's something else going on in their life. They're hurting. They talk about it as a kind of cry for help. And when that cry for help isn't answered, they may go further down the rabbit hole and then wind up actually engaging in these horrific acts of violence. And so it's preventable, but we all have to take action and play our part.
So I think that's very helpful, because what I want to talk to you about, again, local leaders find themselves leading and being the face of response. And when an act related to hate, extremism, and the violence happens in their city, they have maybe one or two responses. The first thing is they're out there in the aftermath of the hate attack, and they are the ones that's creating a response. And then the second is prevention, putting the work in to build stronger cohesions across their community to prevent it. I, again, know that when I was a mayor back in the day, I wasn't prepared. So I want to ask you, what resources does the Department of Homeland Security have available to help a little old country mayor back in my day to deal with such an issue by whether it's responding or just preventing this? I call you up. What can you provide me as a resource?
Well, there's a whole host of resources that we can provide, but they're all based on partnership, and they take time. These resources take time for us to build together. So I'd like to talk to you a little bit about our approach, because really the thing I think we have to offer more than anything else is our approach to violence prevention. I mentioned earlier that we have to do this work through partnerships. So I have a very small team at the Department of Homeland Security. It includes field staff. So I have individuals in around 20 out of the 50 states across the United States, but they travel, they each are responsible for 3 or 4 states, and they partner with communities in those states to build these prevention programs. We have a $20 million a year grant program called the Targeted Violence and Terrorism Prevention Program, and city governments and county governments, state governments, non-governmental organizations, universities are all free to apply for this grant program. Last year we awarded 34 different grants in rural locations, in urban locations, really diverse set of grantees that have taken that financial assistance, and then we partner with that organization to build capacity on the ground. We have a research and content development team that develops either training packets or technical assistance packets to help local partners build capacity on the ground that's based on research and evidence. And then we have a strategic engagement team that's working with our federal partners to bring other resources to bear outside of our limited resources. How can we tether your prevention work in your city to the violence prevention work that's being done by the Centers for Disease Control or the Surgeon General's office or SAMHSA, HHS? There's other violence prevention programs that the federal government funds that are not about targeted violence and terrorism prevention, this hate-fueled violence that we're talking about. But man, those capabilities really can work in this space, right? They can apply. And so we can help connect you to other federal resources through our strategic engagement team. But to go back to where I started, really, we have to build these prevention programs with you over time. And one of the most important things we can offer is our approach. For too long in the United States, we've relied on a criminal justice set of solutions for things like terrorism. That doesn't really hold up. There's nothing wrong with partnering with our criminal justice community. That's not what I'm saying. But there's a structural gap that law enforcement centric solutions that rely solely on law enforcement just can't plug, because we have really important constitutional protections in our country. So freedom of speech and freedom of association, for example, means that it is legal to support even extremist movements or violent extremist movements with your words or your participation, so long as you don't break another law. And as a result of these important constitutional protections, if a domestic violent extremist intends to kill or injure somebody, so they have a violent plot in their mind and they intend to carry it out, the success rate is about 60%. Because all they have to do is go out the door one day and do it, right? There's very little that we can do legally to prevent someone from engaging in violence in a free and open society if they have their mind set on it. And so that structural gap, we've got to fill it. And we've got to fill it with something that's not a criminal justice centric solution, but a more whole of society solution. And what we've arrived at the Center for Prevention Programs and Partnerships is a public health informed approach to upstream violence prevention. We're leveraging 40 years of research and practice that's been studied and evaluated from other forms of violence prevention. Right? Since 1983, the Centers for Disease Control has been looking at how do we prevent suicide? How do we prevent intimate partner violence? How do we prevent community-based violence? And I'm not saying that these are perfect solutions that work in every instance, but we know how to reduce the likelihood of violence by engaging in these public health informed practices. We've just never applied them to hate-fueled violence in the way that the Center for Prevention Programs and Partnerships is now applying them. And so we have a really well thought out strategy about how to apply these public health informed principles, how to create multidisciplinary partnerships on the ground with law enforcement, with mental health and behavioral health specialists, with our schools, with our local government, to create these safety nets to decrease the likelihood of violence. And so this approach, we think, has a lot of practice, a lot of promise. And as we talk to partners around the country, it just strikes them as pragmatic, right? It makes sense to them. It's cost effective. We know that it works. It's just a question of how do we organize around these principles in an intentional way.
Yeah, that's interesting, because I don't think most would think about this in terms of public health informed strategy. But when you list, CDC and SAMHSA and HHS, all of those agencies are dealing with the mental health and the entire person in terms of their strategy to helping America be healthy and productive. And if nothing else, I do think that approach is one that most officials may not even consider. They perhaps most often consider the criminal justice system. And I really think that's something that we're going to try to promote here at the National League of Cities, because targeted violence and that kind of hate, terrorism, it's not motivated by the criminal justice system. It most often could be motivated by the public health and mental health of our society. So I appreciate that sharing that approach. I want to talk to you too about another challenge that many local leaders is anticipating, what may trigger further hate, extremism, and polarization in their communities. Are there ways that these leaders can be looking ahead to what might impact them if this occurs? Anything you're seeing on the horizon that our listeners should be thinking about as we continue to deal with this challenge?
Sure. So let's think a little bit about the nature of the challenge that we are trying to prevent. I would say that it's an enduring challenge. The challenge of violence and targeted violence, while that term might be new, it is nothing new in the United States. For the last 25 years since the Columbine incident, we've seen an increase year on year of school shooters. Al-Qaeda was created in August of 1988. That's 35 years ago. They fought two superpowers head on, and that movement continues to inspire some individuals to violence here in the United States and around the world for the past 35 years. The KKK was founded at the end of the Civil War well over 150 years ago in the United States. So these are enduring issues. And while it is tempting to try to predict the next hotspot or the next hot button issue, really what I think we have to do as pragmatic leaders is say, we know that violence is going to manifest, or that there are going to be individuals trying to manipulate people to engage in violence. We know it's true going forward because it's always been true in the past. And so what can we put in place right now that will decrease the likelihood that works and that violence ever manifests, regardless of what happens next? I don't know anyone who predicted the Hamas attack on Israel on October 7th. But I know every university and every high school is trying to grapple with the challenge that has posed to civic debate and civic discussion and freedom of speech on our campuses in high school and colleges around the country. Right. So predicting October 7th, well, it was a strategic surprise. No one really was able to predict that. But we can predict that there's going to be some hot button issue that's going to make it challenging for us to maintain cultures of nonviolence on our campuses or in our townships or in our cities. And so what are those long-term programs we can put into place that will work no matter what that unpredictable future reveals? And that, I think, is one of the real values of this public health informed approach. It's based on understanding shared risk factors associated with different forms of violence and shared protective factors that decrease the likelihood of violence. And what these programs do is say, how can we try to increase protective factors, i.e. the strengths, the things that make our individuals, our peer relationships, our families, our school campuses, our county strong? What are those factors that make us strong and resilient? And let's build on those strengths to crowd out vulnerabilities to risk factors, which we all deal with, right? We all address. And that sort of long-term approach is really flexible in the sense that there's so many different ways different parts of our community or our government can participate in a positive way to decrease the likelihood of violence. So if it's okay, can I give you a few examples of sort of different versions of these kinds of public health informed programs that different parts of our communities can actively participate in?
Yeah, Bill, I think that's very important because, one of the things about local leaders, they learn from each other. And if we got some examples that we can pick up the phone as the National League of Cities and highlight, we'd love our listeners to hear about where it's actually being implemented as a strategy.
Absolutely. So, and you've got the right partner with the Strong Cities Network. They have a cohort of 20 mayors right now who are sharing lessons in the United States on issues exactly like this. But they're also tethered to, as you mentioned, 200 other mayors from outside of the United States who are grappling with these issues. And so that peer-to-peer learning that Strong Cities is really based on is a fantastic opportunity for your listeners to learn real-world examples about how this can work in a city just like theirs. So when we look at different levels of prevention, and you could think about your own sort of medical life in this as an analogy, right? So you've got primary prevention. This is your diet and exercise. These are the things that you could do as a community that decreases the likelihood of negative outcomes down the road. And really, it's about building on strengths. So think about a high school. That high school has a choice. It can either create a culture of mentorship in which seniors are positively rewarded, maybe on their resume or on their transcript for college applications, for mentoring freshmen, or the high school can allow bullying to become the norm, in which seniors look at the freshmen coming out of several years of the COVID-19 response, lacking some social skills, and they can exacerbate that and bully that freshman, right? Two choices that create two very different cultures in that school. It turns out, when you look at the research, that students who are bullied on a regular basis, evidence on surveys a much greater likelihood of support for violence against their community, or even political violence, terrorism. Right? There's a linear or a correlation between bullying and support for violence, because these students are being harmed and they develop a really negative antagonistic relationship to their surroundings and to the institution around them. And in frustration, they may lash out violently as a result. So we fund a program called Invent to Prevent. We've run it in about 30 states around the country at the university level, and about 25 at the high school level. About 1,100, 1,200 students have gone through the program to date. And you give the students a semester and you ask them to create a program that increases sort of these positive strengths-based characteristics within their high school or their college or their community, and decrease risk factors to violence. And the students, these are life-changing experiences for them. They realize that they are the solution, that they have agency, and they can create a culture of nonviolence on their campus. They can keep themselves and their friends safer. And it also is usually often transforming for the school, because these are low or no cost programs, but they have incredibly positive benefits for that school. You see lower rates of bullying, lower rates of suspension, really important metrics that come out of these programs. Some students create programs that foster civic debate, respectful civic dialogue. Think about how important that is after October 7th, as we're seeing many schools grapple with how do we have these free and open conversations about difficult issues. Well, we've got student teams who are doing that, incredibly well through this program. So the Invent to Prevent program, it's a classic example of primary prevention, building a culture by building on strengths in that location to crowd out vulnerabilities or sort of the enabling factors that might let violence seep in. Secondary prevention programs, these are safety net programs. So that culture of nonviolence, it's not going to work in every instance. You still might have someone who sees violence as an attractive solution to a grievance that they have, or an attractive form of empowerment. And what we know from past attacks is that there are often behavioral indicators associated with violence. So individuals start to fixate on violence. They start to fixate on previous attackers. They leak their intention to engage in some sort of violent act. They may exhibit signs of suicidality. They may socially isolate from their previous relationships. And so when you see one of these behavioral indicators, it doesn't mean you need to call the law enforcement community, but you do need to ask that person if they're okay, what's going on. I think of this as a corollary to suicide ideation. We know now that if someone ideates about suicide, you say, Bill, are you okay? Are you thinking about hurting yourself? What's really going on here? And then you get that person access to direct service providers like clinicians or a social worker who can help them with whatever is going on under the hood. We don't do that enough for threats of targeted violence, but we could. And my organization is now working with counties and cities all over the country, building what are called behavioral threat assessment and management teams. An anonymous tip line. If someone is worried about their friend or their roommate in college, there's a non-criminal justice number that they can call. That person has an assessment done by trained professionals who then help get them into a case management scenario so they get access to mental health or behavioral health or a social worker, whatever it might be that they need to reduce the likelihood of violence. And by doing these in a non-criminal justice way, as early as possible, the outcomes are much, much better for that individual, right? They get access to the services they need. They're much less likely to wind up incarcerated or investigated for a crime. They're much less likely to engage in violence. These behavioral threat assessment and management teams are being stood up all over the country. Sometimes states are supporting them. Sometimes counties are taking the lead. The School Safety Center in Wood County, Ohio, has an incredible program. The state of New York has set up 16 behavioral threat assessment and management teams to date, on their way to about 36 that they'll set up total. And just in the last 6 months in New York, just to make this real, in the last 6 months in New York, the 16 teams that they've stood up at the county level have conducted 250 interventions. They claim, a dozen or so were cases that they know were going to end up in an act of violence had there not been an intervention. And in 2 instances, 2 separate individuals had written a manifesto and stockpiled weapons. So we know that these programs work, that they can protect the student, they can get the student or the employee, doesn't have to just be a student, access to services that they need. And just for the city leaders and the county executives listening, there are huge financial costs to not doing this prevention work. Right? The Boston Marathon bombing, if you look at direct and indirect costs, in addition to the lives lost, the cost of that attack is estimated at $500 million. And so the state of New York, they've paid for their prevention work probably for the next decade in the first 6 months. And they've also saved a lot of lives of a lot of New Yorkers. And so I think there's a really compelling reason to do this secondary prevention work.
Yeah, I mean, that is very thoughtful and helpful for us to be able to think of that in that way in terms of prevention. It's a lot cheaper than just reaction. And being able to, again, it's just really stuck with me on this public health informed approach to this work. I want to flip the switch a little bit with you. I'm going to ask you a question. What does the federal government need from America's city leaders who are on the ground with their constituents every day to help curb the trend of growing hate and extremism? And how can we strategize to take on this work together?
Thank you for asking. It's a great question. I have a few thoughts. The first is help us to communicate to your communities that this violence is often preventable. We don't have to accept it as a norm. In fact, we can normalize prevention. We can listen to people who are crying out for help, who are making veiled threats of violence. We can take it seriously. And then we can create the referral mechanisms so that those individuals can get access to support before they engage in violence. So help us with that public awareness, and then partner with us to build those violence prevention capacities, those safety net programs that we know how to build. We just have to sort of allocate the energy and the resources. Work with Strong Cities Network. It's a great partner. It's the perfect partner to create city-level programs. And those city-level programs or those county-level programs should really tap into the public health resources that already exist. We already do violence prevention with a public health informed set of principles. Your offices of public health and public safety can partner in this regard. And maybe importantly, bring those professionals into the targeted violence and terrorism prevention space. For too long, we've told them not to worry about this. This is national security, Homeland Security stuff. That's exactly wrong. Right? We need our mental health and our behavioral health clinicians. We need our social workers, our human services workers. We need our school counselors to recognize that they already have much of the training and the network, the professional network to do violence prevention, because the underlying risk factors and protective factors are very, very similar. So let's bring the public health violence prevention community to the table and empower them to be part of the solution, because they are. Let's bring Invent to Prevent programs to your high schools and universities. These are incredibly powerful programs. We have high school students that have gone on to change the law, for example, in Louisiana around school safety. Right? You're basically investing in future violence prevention professionals when you run these programs, in addition to creating these positive cultures in your schools. Make sure that clinicians and violence prevention providers, school administrators are aware of something called the Prevention Practitioners Network, or the PPN. This is a community of practice in the United States. There's about 1,400 members in this community of practice right now, and they have all different backgrounds: law enforcement, public health, education, but they all recognize that they have a role to play. together we could 10x the size of that network in the next 6 months, right? Get more individuals into the prevention practitioners network so they can peer to peer, they can share, they can learn, they could get more comfortable taking a more active role in this violence prevention work. Similarly, for your private sector partners, there's an organization called the Association of Threat Assessment Professionals, and they train behavioral threat assessment and management, which has a role to play in workplace safety and wellness programs. We could do the same thing with our workforce as we do with our student bodies, making sure there's these wraparound services if someone starts to go to a dark place. So there's lots of resources out there, and we have to make sure that our institutions and our citizens and our practitioners sort of have access to those, the right venue for them to be a part of this solution.
So thank you for that. And I'm going to give you a promotion right quick here. And I'm going to say that if you were mayor of your hometown, Mayor Braniff, what would the first two things you would do to start a process of creating this public health informed approach to dealing with hate and terrorism in your community? Now, you're mayor. I need you to own that for right now. What are the first things that you would do?
So I'd ask my offices of public health and public safety to, and perhaps school safety, if I have one, to work with one of the regional prevention coordinators, which are my field staff from the Center for Prevention Programs and Partnerships, to come up with a plan, a strategy for how to identify the right human capital, to create the right programs, and secure the funding to build these prevention capabilities in my city. You have to have a multidisciplinary team. It's not just public safety. It's not just public health. It's not just schools, right? Ideally, these communities are working together. You have partners at the federal level who can help point you to resources or non-governmental organizations that can support you. One of the things I might charge them to do is look into the Targeted Violence and Terrorism Prevention Grant Program. This is, again, a $20 million a year program to create these kinds of programs. It's run by my office at CP3. And that is often the seed funding that is used to start something new, as I then work with my my bean counters to figure out how we're going to sustain these programs once we get them up and running with maybe some grant dollars. So I would start there. I might ask them to consult a resource called the Prevention Resource Finder, which is a website that my office CP3 runs. And it has over 100 resources from across the federal government, all related to violence prevention and targeted violence and terrorism prevention more specifically. And so in addition to some grant funding and liaison with the regional prevention coordinator to help you strategize, there are 100 plus resources from other federal entities. There are training programs, there's research, there's a wealth of information there. And basically what I would do is try to figure out how to tailor that information to my city, right? We know that every city is different. They have different strengths to build upon. They have different concerns that they might have at the top of their list. There's not a one-size-fits-all solution here, but there's a menu of resources out there. And I would get a few smart folks together to start figuring out how to tailor this prevention work to my city.
Well, City Speak subscriber, let me say that we've had a very, very informative guest here today, Bill Braniff, who is the director of the Center for Prevention Programs and Partnerships at the Department of Homeland Security, has given us a lot of information in regards to our role and responsibility to leading in this most challenging time, where the rising issues of hate, extremism, and polarization is coming to our communities, whether we like it or not. Many of us recognize that when we ran for public office, this was not the number one priority. But for many communities, this issue of hate, extremism, and polarization is becoming one of the top priorities. The thing I got from you, Bill, I can say is that, this responsibility lives, one, with maybe the public officials, but it also lives with the university systems, the educational systems, the nonprofit, the private sector. So I found that this is going to take the entire community in order to address and be aware of their role. And I want to thank you for that, because this is going to be a very helpful podcast for our municipal officials, but even those that are not municipal officials, for us to approach this in a public health related perspective is going to be helpful for all of our community. So thank you so much for joining us. And I appreciate you being here.
It is absolutely my pleasure. And we look forward to working with your listeners to help keep their communities safer. So I hope your listeners will reach out to us.
We will at the National League of Cities as well to work with you. Thank you.
Thanks.
Thanks for listening to City Speak with Clarence Anthony. If you like this show, let us know. Share this episode with your friends and make sure to subscribe. We're curious to hear what you think, what you want more of, and how we can improve. If you have feedback or an idea for a guest you'd like Clarence to sit down with, send us your thoughts at cityspeakpodcast@nlc.org. Join us next month for a new episode. Like and subscribe here or wherever you get your podcast. See you next time.